The health department says COVID-19 cases in Metro Manila have yet to reach its peak numbers. In today's Laging Handa briefing, Health Secretary Maria Rosario Vergere explained that the number of cases in NCR fluctuates, climbing to 8,000 cases at one point, then dipping to 5,000 cases. Vergere said the DOH continues to monitor the trends, but data shows that the COVID-19 surge in NCR has not yet peaked. This is contrary to the analysis of OCTA Research Group, which said there are preliminary indications showing that the infections in the capital may have already peaked.
Meron ho tayong itinala na sa NCR na almost 8,000 cases in a day. Pagkatapos po nakita ho natin na nagpatuloy siya dun sa trend na 5,000 to 5,500 cases per day. Tataas, bababa, tataas, bababa. So at this point in our analysis, hindi pa ho natin nakikita na nagpipik na po tayo dito po sa mga kaso.
On that note, Professor Guido David of OCTA Research Group is joining us over the phone. Sir Guido, good evening.
Hi, good evening, Riza.
Professor, what's your reaction on the Department of Health's countering OCTA's preliminary projection of NCR's peak?
Well, of course, that's understandable. To be fair, what we're seeing is in its very preliminary stages. It can still change, but what we're seeing right now is, and what we said is that it may have already peaked. We're not saying it as something definite. We would like to see the trend continue for a few days. I mean, maybe for the coming days for next week. But what we're seeing right now is that the reproduction number in the NCR has decreased already. It's now around 1.22. We're projecting a further decrease today. And though I agree with USEC that cases have not yet significantly decreased. We had the record high last week. But what we're seeing is that the growth rate has decreased significantly. In fact, it's possible that we might have a negative growth rate as of today in the NCR. This would be the first time, but I haven't seen the latest data yet for the NCR. But for the Philippines, for the entire country, we have a negative growth rate, negative 2%. That means this week's number for the past 7 days is lower than last week's number. And this is the first time we've seen a negative growth rate since July.
Professor, the Department of Health also admits challenges in the submission of data. Is it possible that there are perhaps discrepancies?
I'm sorry, I didn't catch your question. Is it possible that
there could be discrepancies, Professor?
Yes. It's very possible. We are aware of that cases might actually be higher than what's being reported. But we're also looking at the trend. So even if the cases are actually higher, if the trend is starting to decrease, it should still hold. It should still be valid because we are testing a significant number of cases, and that should give us a good idea of what the trend is.
Sir, do we already have new projections amid the new quarantine system that is implemented in Metro Manila?
Well, unfortunately, Riza, because this is a new quarantine classification, or it's something new to us, we don't really have any projections right now. So unfortunately, we'll just have to wait for the next few days until we start seeing the effects of this granular approach. To be fair, what we're seeing right now until today is still a result of the recent MECQ, because what we have noticed is that it usually takes at least 2 to 3 days after before we start seeing the effects.
Sir, do you already have information perhaps on the COVID situation outside of NCR? Are there emerging COVID-19 hotspots?
Yes, actually, there are several emerging hotspots, and unfortunately, Western Visayas is starting to become a hot spot again, with cases rising in Iloilo City and in Bacolod. Also in other parts of the country, I think in Region 1 in Pangasinan and La Union, we're also seeing some increase in cases. There are a few others, I think in Isabela, but I mean, there's actually a lot to list down. But what we're noticing is that the trends in Calabarzon, mainly in Cavite and Laguna, they have started to stabilize, meaning that we're also seeing a negative growth rate in these areas.
Finally, Professor, are there any other COVID-19 observations, like what you mentioned, trends that you would like to share with us?
Well, it's still basically the NCR that we're waiting for. We're hoping that we're right, that the cases have peaked in the NCR. But again, these trends are reversible. So that means even if we may have peaked, it can still change, because the trends are really a result of what of our behavior, of what we do, and that's why it's still important to follow these health protocols, quarantine restrictions, wearing face masks, social distancing, etc. But really, I'm getting more optimistic. I'm becoming a bit more optimistic that we should have this under control by October, and I really think we'll have a good Christmas this time.
Certainly hope for the same thing. Thank you, as always, Professor, for sharing with us your insights and your time. That's Professor Guido David of OCTA Research.